In 1971, researchers from the Uganda Virus Research Institute, which was formerly called the Yellow Fever Virus Research Institute, caught and isolated mosquitoes that transmitted the yellow fever virus in Zika forest in Kisubi along Entebbe Road. Today, though, much like is happening in other forest reserves in which yellow fever mosquitoes reside, Zika forest is being encroached upon. This means the natural habitat of the mosquitoes is fast disappearing. Dr. Lois Mukwaya, who has been researching the trends in yellow fever since 1965, says the country could be sitting on a time bomb.
But what was protecting us here was the behavior of the mosquito, largely, because it was not biting man. Unfortunately today, forests have been cut down, and the mosquito has no choice but to find a place where to stay. It is now staying with us. It's very domestic, and is a effect of yellow fever.
Dr. Mukwaya, who worked as a consultant for the World Health Organization during the 1987 yellow fever outbreak in western Nigeria, castigated Ugandans who were suspicious about vaccines and refused to take them. Officially, 416 Nigerians died in that outbreak.
I'm surprised that people are hesitant. Maybe the ministry didn't carry out sensitization. Understand they went to churches and what? I don't understand that. Because how many people understand yellow fever? They even don't know how it is transmitted.
The researcher, who has a subgroup of mosquitoes which cause yellow fever named after him in recognition of his research and contribution in the field of medical entomology, describes the yellow fever mosquitoes.
Even here you can see these Egypti, black with white dots. Dangerous. Simpsoni is usually in plantations. It's around, is also with white dots. And Africanus in the forest also has got white dots.
Dr. Mukwaya advises Ugandans to take advantage of the mass vaccination efforts around the country, since the mosquitoes that transmit the disease are now in the public space.
That's the only way to protect us. It's very difficult to kill the mosquitoes. But once you are vaccinated, even if it bites you, you are safe.
The World Health Organization classifies Uganda as a high-risk country for yellow fever, saying that if the virus is introduced in crowded urban areas, there could be endemic spread of the disease, not only in the country, but to our neighbors as well, because of frequent population movements. Gillian Nantume, NTV Tonight.